Right?
Let's go.
So, well, welcome back. Excellent. This is February 3rd and our number 15 program. And so we'll go ahead with it. Let's see. Presenting symptoms have not changed. So it's the same thing: cough, dry cough, shortness of breath, difficulty breathing, fever, chills, muscle pains and aches, sore throat, not that much, and new loss of taste and smell. I talk to people, they really sometimes complain of a lot of muscle aches and joint pains, and which is, indicative that they may have, especially if they have exposure history contact. Now, this is our, numbers on the worldwide cases. They have gone up quite a bit from last week, January 27th to February 3rd. So you can see that, and so is the number of deaths have gone up, but not with the same rate as it used to be. And the US has almost 26.1 million, now 27 million. So that was number of cases, and deaths have been 457,884. Last week there were 435, so 22,000, which is not bad, So, I mean, it's still bad, but not as compared to the 2 weeks ago when we had over 40,000 deaths. So, and here you can see Wisconsin cases and Columbia County. In Columbia County, there are 6 more deaths from last week, but the cases are not proportionally, about 100 cases more. And so this is the New York Times update today. You can see in the 7-day average in the curve here, right at this spot. Towards the middle of the January, it was the highest. Now it is going down, and quite a steep downtrend. And so our cases have reduced 30%. Whether people are avoiding and masking and distance, so they are controlling it better way. And the deaths are still 2% more, and hospitalization did go down 22%. So that is 7-day average. Let's see what's happening. Hospitalized patients by day, good thing, they're also coming down. And this is going to be February. By the end, we're going to have fewer patients in the hospital. But the other alarming thing is that the predictions are much higher. I'll show you because of the complications of the illness. New reported deaths by day, little peak in the beginning of February, but now is going down. Still, if you look at the numbers, they're pretty high, so we have a downtrend in July and October, then November, Thanksgiving, December, Christmas, and New Year, it kept going up, and now it is going to be down. So that's a good thing. Let's see the predictions. And you see the steady rise from August all the way from 300, 350,000, 400,000, 450. And right here on where the arrow is end of February, that time. So we will have 500,000 deaths. So you can see that their predictions are much higher. So we are approaching there. We have over 460,000. So I think it's going to happen. And very unfortunate that we don't have this curve going down. Prediction should be going down, not up. And here is the variance of interest, which will be uh, all over in the news. We did talk about B117, which came in the United Kingdom from 11 cases to thousands of cases, spread throughout the Europe, went eastwards. And so now there is a variant to that, 501Y or B1351, which is South Africa, and P1, which is Brazil. And so there is a increased transmission in these variants, and there is also less response to immunity, and it is causing more complications and higher number of deaths. And all these variants are responsive with the vaccine, especially Moderna and Pfizer are saying that these vaccines are working against the variants as well. So, which is a good thing. And if you look at this, COVID-19 cases caused by variants is 467 in the US, and B117, which is UK, Europe, and B135, South America, and then P1 is the Brazil. And this one case reported that is in Minnesota. There is another case, B1351, in South Carolina. So these are the two variants of Brazil. And so those people had no contact, no travel. Actually, as a matter of fact, the Minnesota guy came from Brazil. He did travel. But South Carolina person did not have any history of contact. So it must be the mutation. It must be the change in the virus which has caused that spread. So let's go to the next counterfeits. Fake COVID-19 test certificates for sale. I bring you all those news sometime, there are scams going on. They call you, get a test, we will mail you and you send us the sputum, we'll give you a report, all fake, don't fall for that. Fake COVID-19 test certificates for sale because airlines want them. Your employer may need them. So forgery ring Charles de Gaulle Airport, Paris, $180 to $360. UK Luton Airport, which is south of London, about I think it's about 60, 70 miles, $140. Spain online, $50. And Netherlands messaging application, 60. They send you a message, $60 to 70. I don't know why people will pay 140, 180 for a fake when they can get a fake for 50. So, but that's not good either, And in China, Beijing, they found 3,000 fake doses of vaccine, and it was normal saline, salt water. And they were actually selling it higher than their real vaccine. So making people think that they're buying the real stuff. So these are costing more than Sinovac and Sinopharm, which is Chinese vaccines. I'll talk about it in a few minutes about that as well. So don't fall for this trick. Don't buy any certificates. Only certificate you need is your shot certificate or test certificate within 3 days of traveling, especially international. Double masking, CDC is a little slow in implementing or recommending these changes. April 3rd, 2020, we started in March, the episodes, infection. April, they came up with a recommendation, the mask to protect others. So source of control. So they wanted to protect the others. November 19th, which is 7 months later, CDC recommends masks to protect others and the wearer, so it's for both. Filtration of personal protection. It was that you don't spread it and you don't inhale it. So, but it was 7 months late. And the surgical masks are made of melt-blown, non-woven polypropylene, and they disintegrate, but they have a very fine mesh which will prevent 1 micron of the width of the virus. So we did talk about a few weeks ago about different kind of mask. One was surgical, one N95 with the filter, and which is more expensive, used in the hospital. Then there were 2-layered linen and 3-layer silk, and more the layers, the better it is. But now 4 or 5 weeks later, CDC finds out that double masking is better than single. I'll tell you why, but they have not recommend this. They did not recommend or mandated double masking. These are different masks, 2 layers, tightly woven fabric, surgical mask with a fabric mask inside, and the very tightly woven fabric, which is a filter and outside mask. Now, basic protection is the high quality surgical mask or a fabric mask, at least 2 layers with high thread count, a thick one. Maximum protection, 90% efficiency, is for particles of 1 micron. So that's the diameter of the virus. Cloth mask tightly on top of surgical mask, where the surgical mask acts as a filter and the cloth mask provides additional layer of filtration while improving the fit. So if you put a paper mask, surgical mask, which you buy, then put a cloth mask on it because it is better fit on the nose and the sides and the chin. So it snugs the under mask, and then it doesn't allow for the air to pop in and out from the side or the top of the nose. So that's why it's a better fit with 2 masks. So if you go out, I think it's better to wear 2 masks, especially if you're traveling in a bus, a train, or car, or an aeroplane, or taking a vacation by sea. So you should be taking them off only when you're eating or drinking, or you have any other emergency, take medication. In the bars, 50% of the people who attend bar wear a mask, but other 50% don't. And this is a matter of concern, and should be careful about that and give a distance to the strangers as well. This is COVID-19 cases and transmission, 17 K-12 schools, Wood County, Wisconsin, August 31st to November 29th. They enrolled, all the students of the school district, was about 4,600 or 800 students, and there were about over 400 teachers. And they all wore masks. And they wore masks during the school time. All school time period. And they took the mask off only to drink or eat. And all their activities were indoor, so they didn't go out. So they were taking a recess or lunchtime all inside. And the staff was distanced. And students gathered like in a class 11 to 20 in numbers. So there were small classes, distance, wearing a mask. And it's amazing how it worked. Community rate of infection of positive was 7 to 40% in the community. It's a small community, just like Cambria. 7% to 40% people were positive. So that is the Wood County, this dark black line up on the top. This was the number of cases who were positive in the county. And look at total cases of all school districts, these broken lines, and that's how low it is, And then cases attributed to in-school spread in all school districts is almost zero. Right at the bottom, the dotted line. So there was no spread in the schools. Unbelievable. This is such a good example of having strict rules. So it proves that we can open the schools provided we have all the CDC recommendations. So it's a good for teachers to know, and it was good data and very good report. Now the vaccines, let's talk about a few minutes about that. And this is my, I think, a few slides on the vaccines and other things. Novavax is a 2-dose, 21 days apart, and is stable for 3 months in the refrigerator. It's not available yet, but end of February or March, April, this will be available. And Sputnik 5, 2 doses, 92% effective. It is available. Millions of people had it in China. And this is the vaccine which is promoted on the East. Sinovac is a 2-dose Chinese called, the vaccine name is CoronaVac. And Sinopharm, Sinopharm is a Chinese produced, used in UAE and China, and Malaysia and India and Pakistan. Chinese have donated millions of doses to those countries. UAE, I think, bought it, and any visitor who goes there gets the Sinopharm. And is one, no excuses, everybody gets it. All the population and all the visitors, anyone who passes through the airport gets it. They have temperature machines, and when you're going through the corridor, your temperature is recorded on the screen. And all those people who have a little temperature are channeled different way. But they're then question about contacts. Those who are not, the normal temperature, they go through the line to get the jab. So everybody is given a shot. Pfizer has 2 doses. This has been used here now, 21 days apart, 95% effective. And Moderna 2 dose, 28 days apart, and 95% effective. The people did say that Moderna has a little more pain after the second shot, but there should not be any difference because both are RNA or vaccines. The others are antigen from the virus, altered virus vaccines. AstraZeneca, 2 doses, 72% effective. Question is why people will have AstraZeneca when efficiency is 72%. But in certain situations, this may be if there is a shortage of vaccine and in a mass places like nursing homes, where the controlled environments, you watch who's coming in and out and you give your residents. So 72% is not bad. So Johnson and Johnson also 72% effective, one dose, and they have 3 months life in the refrigeration and 2 years in the freezer. They have 7 million doses released and about 30 millions by end of the month and 100 million by end of June. So you can see that Johnson and Johnson called Jensen vaccine, it will be out, and AstraZeneca is almost there. So we will have plenty of vaccine to use. Russian Sputnik 5 coronavirus vaccine gives around 92% protection against the COVID-19. Sputnik jab uses two slightly different versions. One lower dose to tease the immune system. So when they start making little bit antibodies, they give stronger dose, which full-fledged protection. So they're given 21 days apart, very effective. Idea is that using two different formula boosts the immune system even more than using the same version twice and give longer lasting protection. Will it last 10 years like a tetanus shot? It's unlikely, but they will come with the improvement because this is all done in a hurry. Usually vaccines approval by FDA takes 10 years and they've been done in few months. So the mechanism of Pfizer and Moderna is entirely different. It is not a viral stimulated reaction. It's an RNA which changes, your cell structure, and but doesn't cause any mutation on the people. Or one person said, "Oh, I'm going to grow fins on my head and all that." I said, "Nothing happened. Not really. It's not going to happen." But there are people who are against, and I show you that. This is Sputnik again. Works a similar way to Oxford AstraZeneca. Jabs developed in the UK, and Johnson and Johnson vaccine, which is developed in Belgium. It uses a cold type virus engineered to be harmless as a carrier to deliver small fragments of coronavirus to the body. So it creates a reaction. So this is, that's a Dodger Stadium vaccination site shut down by anti-vaxxer protest. They have this road going to the stadium for getting the shot. They blocked it and they put on "Save Your Soul, Turn Back Now." So they may have a direct connection somewhere. I don't know. So I thought it interesting. We see this in a LA time 2-3 days ago. Israel, Pfizer vaccine, they started giving to the whole nation. 70% of 60 plus have had 2 Pfizer vaccination. So they're really up, number 1 in the world. And we are way down. So don't even have 10% people vaccinated. They're 70% over 60. And UAE is about 60%. They're going to have in a month, and they'll have 100% vaccination. Last week, vaccine offered to 35 plus and 16 and 17 years old. People are doing holidays to go to Tel Aviv and get shot at the airport and come back. Target is all 16 plus by end of March. So 42% of 834 critically ill patients had already received one dose of vaccination. So if you're down with COVID, there are 42% of those people, they received the vaccine as well. If you had COVID infection, 2 weeks later, maybe it's a good idea to get the vaccine, because COVID infection does not guarantee a protection from the illness, getting the virus. Racial disparity in US vaccination campaign, quite a bit. Analysis from Associated Press, 17 states through January 25th. Black people in all places are getting inoculated at levels below their share of general white population or general population. Black people constitute an oversized percentage of healthcare workers who were put at the front of the line for shots when the campaign began in December. So they are there to a lot of people there. Example, Maryland, blacks were 30% of the population and 40% of healthcare workers. So you can see the disparity. 30% of population, 40% of healthcare workers. Only 16% of the vaccine recipients so far. So you can see the problem there. Now, why this is so? Why the blacks didn't get the vaccine? There are several factors. Number one, it could be education, could be overcrowding, inability to travel. They cannot access internet access. And then there are sites which are black neighborhood. They have been inundated with the white population, visitors coming in to get the shots. So there are no shots for blacks. So this is a fact of life. It will improve. Federal Register notice wearing of face masks while on conveyances and at transportation hubs. That means buses, trains, aeroplanes, and vessels, and all kind of transportation. Now this came now, January 29th, after almost 1 year. And the law, which is signed on 29, is the preservation of human life. That's the law. And if you break this law, you are imprisoned. The police and law enforcement, and they're all will be watching. So pertains to travel on aircraft, train, road vehicles, and vessel. People must wear masks over nose and mouth on conveyances and at transportation hubs where the centers are. Conveyance operators must require all on board to wear masks for duration of the travel. The moment they checked in, the moment they disembark. Conveyance operator must use best effort, ensure compliance with masking on boarding, disembarking, and during travel, boarding only those who are masked, and monitoring masking during the travel, instructing that non-compliance is a violation of federal law, kicking the non-compliance off as soon as possible. Exceptions are eating, drinking, oxygen, and other identification or communication, etc. So The law is there, so we should see a downtrend. I tell you, this is going to make a big difference as well. Um, I talk too much, right? That's it. That's it. That's it. This is our Cambria Fire Department 212, 226. Asperus Divine Savior, Columbus Hospital also, I think, has been giving Marshfield, of course, and Beaver Dam. Let's go with the question if you have any.
What was the last thing you said, Doctor?
What's the last?
About Divine Savior and the fire station? What are they doing? Testing or
Columbus, yeah,
vaccination?
uh, Columbus Water and Light on March 2nd, Marshfield Clinic Health System, Beaver Dam, Asperus, Aspirus, Divine Savior, and Cambria Fire Department.
And these are just COVID tests, correct?
Yes, just a test, no vaccine. Vaccines are given. I think the public health has managed to uh, formulate those sites. Would be nice if they announce it. Other than the hospitals, I mean, they are planning on all the pharmacies, for example. They're getting into partnership with that, and the problem is the storage, and they need -70 for transportation, and then they have to use the vaccine as soon as it's opened. So they're having problem in administration. So we're way behind. So our facilities are not, that well monitored. There was no program, and so I hope this will catch up. They got a lot of retired doctors, nurses, pharmacists who are being called, and uh, state health department are managing that. And if we had applied for Cambria, say, fire department, I don't know if we met their criteria, because we won't have any facility to storage. We have to give it right away. And a lot of nursing homes wasted uh, injections because they couldn't use it but they didn't have help, you know. So that was the problem. Any other question?
So now they are saying that even if you've had COVID and you've recovered from COVID, before they said you were like 90 days, you were probably protected. Now they're saying that after 2 to 3 weeks after healing from COVID, you should get a vaccination.
Yeah, true, exactly. They may have 3 months protection because the antibodies they have been checking last 90 days. But during the decline period, you could get exposure, and depends on the dosage of the virus, how much you inhaled, uh, then you're liable to get the infection. I think it's better 2 weeks after to get the injection to boost the immunity. And but problem is that it's so new that even after vaccination, 2 doses, they say if you go outside, don't give up on the masks. And because they don't know, there has been infection after second dose of COVID vaccine. Um, then, we talked about complications. Pneumonia is number one, and shortness of breath is number two, and blood clots are number three. So the blood clots, because it affects the system, so it can go to the brain, the kidney, the lungs, the heart, peripheries, can make a skin rash, can make a gangrene. So it's horrible to have it. So God forbid, everybody should take care and protect themselves not to have it. And I think the complication from shots is so few, 11 out of a million getting anaphylaxis reaction, which is recoverable, is okay, because our, will we get herd immunity? Like if 70% of the population get immunized, will we all protected? It's matter of to be seen. 100% is much better. I think the data will come from Israel and United Arab Emirates, because their whole population is going to be vaccinated. Okay. Everybody ate already?
Not yet.
No.
I take your meal time. That's what it is. So, well, you go and have a good meal. I'll get your attention next week, 6 p.m. I will have something latest, some figures and numbers and how we are doing. And I think it's a very informative, and you don't have doubts in your mind that what you hear in the media and those scams. So be careful about that.
Are you sending the PowerPoint out, Dr. Sam?
I will. That was a problem because it was such a large attachment. But did you get from last week the PowerPoint? It was.
Yeah, I got the email that you sent that with the PowerPoint.
Yeah, I got the email that you sent it. I did not look at it, but I got the email that you sent it.
Okay, I did because it went as an attachment. So then I don't have a password for that. It's open. So you have to download within, certain period, because
Okay.
it's Google attachment. I'll try to, if it is recorded, I'll send you a movie. If it is not recorded, then I'll send you the slides. I think it's a good idea to review it, because it gives you some solid, correct information. And if you're going to talk to somebody, you can refer and tell them that this is the correct way of doing it. All right?
I know
Thank
I've
you.
already, during your showing, I'll take my phone sometimes and take a picture of the screen. So that if I want to refer to something, I got it right on my phone then in my photos.
That's
Yeah.
smart.
Yeah, picture. Yeah, that works sometimes. It does.
Yeah.
So, but I'm learning this. I'm just, this system of Zoom. Kids know it more than I do.
Oh, my grandkids know it better than me, and I work in the school system.
Yeah, they come in and said, Nana, do this, do this. I said, okay, I'm listening to you. All right. Okay.
Thank you very much.
Yep, thank you, doctor.
Thank you, Doc.
Yeah, thanks a
See you
lot.
next week.
See you. Yes,
Yeah,
by all means. Thank you. If I can find a button,
thank you.
find a button which says goodbye.
Goodbye.
Bye.
Okay. All right. This will end. Hi, Dili.
Uh-oh, grandkids are there.
She's my little angel. Oh,
That's Ozma's, right?
Lulu. Yeah.
Yep.
She loves skating. She loves swimming.
And I'm 4.
And you're 4. Wow. 4.
Yes. She just turned January 1st. 4.
So are they staying with you?
Time, darling? Oh, she's my messenger. It's eating time.
It's eating time. Okay, well, you better go eat.
Doc,
Oh.
Doc, somebody asked me a question that there's some nursing home, they use some pill that's like hypochlorothiazide or something like that. And they said it was very effective. There wasn't a single case out of 1,000 people. Have you heard anything about something like that? Is that a true statement or a false statement?
What kind of pill? What was it?
I can't pronounce it. It's hydrochloroviazine or something like that.
I haven't, in all this research when I do, I have not come across any tablet other than antiviral, which is a prescription. And, but people have taken zinc tablets and vitamin D, but, you know, nothing else. No, it doesn't.